Hello everyone, welcome to 5 Minutes Dentistry, where we make dental concepts easy, quick, and fun to learn. Today, we are breaking down one of the most basic yet most important topics, anatomy of the tooth. By the end of this video, you will know every part of the tooth and what it does, all in just less than 5 minutes. So basically, the tooth consists of three major structures: the crown, the neck, and the root. And in the crown, there is enamel, then there is dentine, and then there is pulp. So, enamel, it is the outer white covering of the crown and it is 96% inorganic. It mainly consists of hydroxyapatite crystals. It is that part that we can see in the oral cavity. Next up, we have dentine, the yellow colored part that I am showing. It is just below the enamel and the cementum lies within the dentine. It is slightly yellow in color, it is softer than enamel and has tiny tubules that carry the sensations like pain or temperature, and it makes up the bulk of the tooth. Next, what we are going to study is the red colored part that is called the pulp. It is the center of the tooth and it has pulp chambers as well as the root canals. Now, the pulp consists of the nerves, the blood vessels, and some connective tissue, all of which keeps the tooth alive and sensitive to the temperature or pain changes. All of the sensations that we feel are in the pulp. The next thing that I am drawing is the cementum, the brown colored part, and this layer covers the root. It is almost like the bone, but it is not very hard, and its job is to attach the tooth structure to the surrounding ligament that holds the tooth in its position. Now, this is the crown part, which consists of enamel, dentine, and pulp, and this one is the root part. And between the crown and the root, we have the neck. The neck is the narrowest area where the crown meets the root right at the gum line. Now, the pulp, it consists of many blood vessels, the nerves, and the connective tissue, as I've told earlier. Now, with the green color, we are going to show the periodontal ligament, that is also called as the PDL ligament, and it attaches the tooth firmly to the surrounding structures so that the tooth does not move from its place. And when this ligament becomes damaged or it ages basically, at that time, what we experience is tooth mobility. When these fibers degenerate due to any further cause, the tooth mobility occurs. Now, the gingiva or the gum part. The pink colored part that I am showing are your gums. They surround the crown portion. The next part that I'll be showing you are lateral canals. These lateral canals are important because they provide a pathway for infection spread. They provide a direct route for bacteria and their toxic products to move from infected root canal into the periodontal ligament and then the bone, and vice versa. So it is the important part. Next, the yellow colored nerves that I'm drawing are nerves that descend into the underlying structures and then they follow the sensations or they conduct the sensations to the brain, and that is what we feel and how we feel the sensations. So here we complete everything, all of the structures, what a tooth anatomy is, and in the next video we will see all of them in detail, their function, the cells, the inorganic and organic matter. Thank you.